We're trying to look at some special considerations if you want to treat cancer of the cervix. So most people call this chemoradiation, okay, but in real sense is what? Chemotherapy and what? Radiotherapy. Okay, so for these two, they are basically being involved in treatment of cancer of the cervix, right? So for all of them, we'll describe how they are done, okay, and when they should come in. So chemoradiation is just simply you are combining what? Chemotherapy and radiotherapy, you know. So chemotherapy is like a radiosensitizer, making cancer cells more vulnerable to them to be destroyed by the radiation waves that you'll be using. I don't know if you understand. So they kind of like complement each other. So chemotherapy, chemo is like, you know, chemicals, drugs, chemicals, while radiotherapy is like waves, things you can't really see. Okay, so for the drugs you always use for chemotherapy include drugs like what? Cisplatin, which usually give it during radiation, is the one that is most widely used. So it enhances DNA damage by the radiation. Okay, so alternatives, you can use carboplatin, you can use 5-fluorouracil. Okay, that's if cisplatin is contraindicated or is not available. Then radiotherapy now, okay, you can see a patient is under, you know, so you basically target it. Okay, so external beam radiation therapy targets the pelvis, so you target it so that, you know, a lot of tissues are not affected. So it targets the pelvis just to treat the cervix, uterus and lymph nodes, typically giving 5 days a week. Okay, so our brachytherapy is internal radiation, so high dose radiation delivered directly to the cervix via applicators. So indication for chemoradiation, like when and why should you combine chemotherapy and radiation? Okay, if the cancer is basically spreading so fast, is going advanced, you know. Also bulky tumors, parametral or lymph node involvement. Okay, so and if you don't want to actually do a surgery on that patient, okay, many reasons why you won't actually want to do a surgery on that patient. So for all of them, they have a side effects. For chemotherapy, you can have nausea, vomiting, kidney toxicity, okay, bone marrow suppression. For radiotherapy, after a patient has undergone the radiotherapy, they're usually very tired. Okay, diarrhea, cystitis, okay, vaginal stenosis. Then there's a whole lot of effect on the bowels, okay, and the bladder, because they are close to the cervix, and there's, you know how you can just stop the radiation from getting to them.